Just welcome everyone to the Insider's Guide to Choosing a Continuing Care Retirement Community. This presentation has been developed over several years and presented thousands of times by Miss Cathleen Toomey, who's the Vice President of Marketing for the RiverWoods Group and has been since 2007. And she is a graduate of Fairfield and Fordham University and started her career in New York City with agencies, and then moving on to build brands like Timberland, Lender's Bagels, Stonyfield Farm, and Babson College. And she has an amazing TED Talk, if you're ever around on YouTube, that you should check out, called The Secret to Successful Aging. And she is also a board member of the Women Aid of Greater Swampscott. So if you wanted to just flip to the first slide, we'll go over the housekeeping and then I'll let you take it away. So as we mentioned, everyone is muted, but we do welcome questions in the Q&A box or comments. This presentation is recorded and you'll all receive a copy of it along with a link or an actual paper copy of the Insider's Guide that we'll talk about. So if you would like a mailed paper copy, just make sure that we have your mailing address on file. If you have any suggestions about how to improve, we're always open and welcome to those. Or if you have an idea for a topic that you'd like to know more about related to senior living or senior life, send us an email, contact us. And with that, I'll hand it over to Kathleen.
All right, thank you, Kim, and welcome everyone. I'm thrilled to have so many people here who are interested in one of my favorite topics. Kim gave me an embarrassingly nice presentation about me. Let me tell you a little bit about who we are. We're the RiverWoods Group. We are the largest independent family of nonprofits in New England, nonprofit CCRCs in New England. We started as RiverWoods Exeter in 1994. We were formed by residents who wanted a different way to live that was better than the options they had seen. So that idea took off better than they ever expected. We have 3 campuses here in Exeter. We have our affiliate, Birch Hill, which is in Manchester, New Hampshire. We recently opened RiverWoods Durham in Durham, New Hampshire. And we have something we call SPE, which is our very corporate title for someplace else. So because so many people now are really attuned to this lifestyle, we know we'll be growing. We're not sure where, but that's kind of who we are. And as Birch Hill, the affiliate of RiverWoods, we've had a long-standing history of over 100 years in Manchester, but became a CCRC in 2009. And we are a Type B contract. And I'm going to tell you a little bit more about the different contract types as we go further in the presentation. Joined the RiverWoods Group in 2016, and the entire community has been hugely renovated. About $14 million renovations, brand new homes. We've taken a lot of homes off the market, so some of them are available. So the advantage is you can move in without a long wait list. It's in a country setting that is just 10 minutes from New Hampshire's Manchester, which is one of our biggest cities. So today, what we're going to start to talk about is setting the stage for this conversation. Why is today's aging different than your parents or your grandparents? What makes it different? Why should we think about aging differently? I'm going to explain the CCRC option and the contract types, and then we'll get into your questions. So we know that things are different today in many ways, but just talking about aging, people are living longer than ever before, and there's more of them. So this is, that you see on the screen, is a chart of demographics, and these are the 75-year-olds. This is where we are right now, and that's where we're going. So we have more boomers aging into retirement than ever before in the history of our country. In fact, it's about 10,000 people a day in the United States turning 70. 10,000 every day for 18 years, which means a completely different demographic in our country than we've ever seen before. There are more of them and they're living longer. So if you're 65, you can expect to live actuarially till 84. If you get to 84, you can expect to live to 92. And if you get to 92, you can tack on about 4 more years. So we're living longer. There's more of us. Many of you have heard that, but the one thing you may not have heard is that the number of people in the workforce at the same time is dwindling. So taking a look at this inverted triangle, which is also a source of the New Hampshire Hospital Association, it talks about what we are looking at in terms of workforce. In 1950, we had 7 people in the workforce for every retiree. Since then, it has dropped. 2011, we had 4 people in the workforce for every retiree. And in 2050, it's 2. This is not 2 people in the senior living industry. This is 2 people in the entire workforce. And you've seen it yourself. Lots of people looking, posters out for jobs. Everywhere you look, people are looking for jobs. So the one thing to know is that people are going to be harder to find to fill those jobs for those of you who are thinking, when I age at home, I'm going to bring everything in. That may be harder because there are fewer people in the workforce. But how likely is it you're going to need care? We did some work and some research on that, and 70% of American couples over 65 will need some form of long-term care. And I think that's shocking. For most people I talk to, they don't anticipate that. Now, we don't know how long the long-term care is going to cost, but we do know a few more averages. We know that 20% of those 65-year-olds will need long-term care for more than 5 years. And women are going to need, 7% of women are going to need nursing home care for more than 5 years, and nursing home care is the more expensive option. Also, another factor is that as we age, the likelihood of getting Alzheimer's is greater. So 32% of people today over 85 have Alzheimer's, which is, again, a costly disease. Speaking of cost, not many people understand the cost of nursing home or assisted living, because let's face it, who wants to think about that? It's easy to think about what you want to do when you go on vacation, what kind of car you want to buy, what kind of new phone you want to buy, but nobody is really out there saying, I wonder how much my nursing home is going to cost. And I'm going to look around and see. So in this study that the AP did, 58% of adults underestimate how much nursing home is going to cost, and 31% underestimate assisted living, which is natural. So we did the work for you. So these are the states, these are the average cost of care done by Genworth. They do a 2019 study every year. And this is the median cost of a nursing home private room, which can be also hard to find because a lot of nursing homes do not have private rooms anymore. So what's the reason for all of this talk about cost? The reason for the talk about cost is if we know we are living longer, and if we know the workforce is smaller, and if we know that we are likely to have care needs, and you're a planner, don't you want to understand if you will have enough resources to care for yourself when you need it? Most people say, I have enough money, I'm going to stay at home and I'm going to bring in care. If that is true, my recommendation to you is that you start researching at-home care companies in your area and find out what is the cost, what is the availability, do they have a waiting list? Because many at-home care companies are starting wait lists, and the cost can range from $20 to $40 an hour and higher. for non-nursing care. Nursing care is a whole different other area, but you could pay up to $5,000 a week, depending on where you are, for 24/7 care. So if this is your plan, take a look at it now. I think the key question is, if you need long-term care, where are you going to get it? What is it going to cost? And who is going to provide it? And if you're a planner, you want to have a voice in that decision. Most of you who are on this workshop probably understand that Medicare does not cover assisted living. In fact, Medicare today has very limited and strictly defined rules of what they will care for. You need a 3-night qualifying stay in a hospital to get 100 days of Medicare. And that 3-night stay has to be admitted, not under observation. We can talk more about that in the question section. Some of you may have long-term care insurance. That's awesome. Long-term care insurance, we think, is a bridge to the future. It provides fixed financial cost for a certain amount of time. But the only thing it doesn't answer is, where are you going to get that care? So CCRCs, which is what we're going to be talking about, answer the question of cost, quality, availability, and location. So let's talk a little bit about that option. Hopefully some of you have heard about continuing care retirement communities. There are 1,900 around the country, and they've been around for 100 years. I don't think we have a great PR agency. I would like to have Kale's PR agency. Whoever's doing a good job, whoever's got the contract for the kale industry, I think is doing a terrific job. But I believe CCRCs are kind of a hidden gem, not really understood by a lot of people. So I'll unpack that a little bit for you here. Most of the CCRCs, continuing care retirement communities, are nonprofit. They're 1,900 across the country. They're generally based in systems, in large and small systems, and they can be faith-based or community-based, and there's a very small percentage that are for-profit. This is going to be a little bit general, but we're talking about 1,900. So in general, a CCRC, the goal of it is you enter when you're independent and you can live safely on your own. So you don't need help. You have to be at least 62 or older. And when you are in the community, you get generally 3 levels of care or more: independent, assisted living, nursing care, and memory support. And once you're in the community, you can transition between the levels of care as your health needs dictate. You have services and amenities at every level, and the levels, what you get in terms of amenities varies, depends on what your needs are. And generally there are 2 fees for a CCRC. One is an entrance fee, a one-time fee, which can be refundable or not. And the second is a monthly fee. And the monthly fee is always tied to the size of your home. So that's true no matter where you go. The larger your apartment or cottage, the more expensive your monthly fee is. And why people move here is because you have more free time to meet new friends, explore new activities. You have less responsibility of home maintenance and working on your house. And you have a lot of opportunity to enjoy your life with the security that if anything happens to you, you get the care you need right there where you've chosen to live. And it is not market rate. It is less expensive. Also, all nonprofits have a benevolence clause, which means if you outlive your assets, you can apply to the community to carry you. So these are 2 of our residents. This is one of my favorite pictures, driving on campus. I think it shows you that it's not what you might expect. So you look at this and you say, this is not my grandparents' nursing home. A CCRC also is something different. It is an insurance product. So when you move into a CCRC, we are signing a contract to provide your housing and nursing needs for the rest of your life, no matter what. The contracts are regulated by the state that each CCRC operates. We report our financial performance to the state annually. All of the financials should be available on every CCRC website. And because it's an insurance product, the government considers that you are prepaying and insuring for your future assisted living or nursing care needs. So you can write off a portion of the entrance fee and monthly fee as tax deductible, which is a really big asset. It's also a lifestyle choice. So you come in when you are independent and you don't need help. And you have the ability to have more free time, have activities, programs, educations, more social options. And for those control enthusiasts like myself, you stay in control of your choices. You know when you need care, who's going to provide it, what it's going to cost, and where you're going to receive it. And you're going to get it right there. So you don't have to leave your home when you need the care. Generally, in independent living, you get 1 meal a day, inside and outside maintenance, housekeeping, transportation, you get access to fitness classes, programmings, your utilities, taxes are taken care of. And then when you move to nursing care, those escalate depending on your needs. We find that most residents are trying new things that they wouldn't try otherwise. So one way to think about it is in one umbrella, you have several different levels of need. And the important thing is, if you need care, the door does not lock behind you. So you could be in independent living, get pneumonia, go over to nursing care for a bit, get your feet back on you, and then go back to your home. It's not a one-time thing. You can go a number of times. So let's dig in quickly to the contracts. And again, this is a general presentation. We have a workbook that I've put together that you can request that we will be happy to send you. So this is just a quick overview. There are 3 different types, A, B, and C. A is also referred to as all-inclusive. This is going to be the more expensive option. It has the higher entrance fee and generally a higher monthly fee. And when you move from independent to healthcare, there is no increase in your monthly fee. The only thing you pay additionally is your additional meals, because in independent, you get 1 meal a day. Type C is the least expensive. So there's no entrance fee, and the monthly fee is the least expensive. But you have no guarantee of healthcare, and there is no discount on healthcare. So there you can live month to month, but you don't have a guarantee of the healthcare going in if you need it, and you will pay market rate if you do need healthcare. Type B is in the middle. There is an entrance fee. It's generally less expensive than a type A. There is a monthly fee, also less expensive than a type A, and you don't pay for healthcare until you need it. So when you need healthcare, you transition into the healthcare portion of the community, and you pay a slightly higher entrance fee, a slightly higher monthly fee. So this is good for people who say, I don't know that I'm going to need a lot of healthcare, so I'm going to hold off and pay for it when I need it. And again, you are not paying market rate, so you're saving a tremendous amount of money while ensuring you have the quality of people who are caring for you. And most of A and B are nonprofits, and C are primarily for-profit. Here I want to talk just quickly about Birch Hill's innovative contract. Last year, we got approval from the state to have the very first flexible contract in New England. No one else in New England has this contract. It's a 70% refundable entrance fee. And generally, entrance fees work that if you have a refundable entrance fee, let's say it's 70% refundable, you get that refund, your estate gets that refund after you pass away. So or if you leave the community and upon your apartment reselling. So that refund of your entrance fee goes to your estate generally. Today, we have an entrance fee where you have 70% of that you can use during your lifetime to cover your healthcare costs. So you can draw down on that 70% during your lifetime to cover your healthcare costs. It is phenomenal. It's like having your own little slush pile of money for healthcare. And you can also use your long-term care benefit. So you have access to money during your lifetime as opposed to only asset preservation. That combined with a long-term care benefit makes this extremely affordable. One thing I forgot to mention in terms of social life is you never know what's going to happen. These are two of our residents who married last year and met at Birch Hill. So it's kind of exciting what can happen here. So what I'm talking about here is that it makes financial sense, and it also makes emotional sense, because within a CCRC, you are staying connected in a much greater way than if you remained in your own home, because you have that access to people right outside your door who are going to encourage you to participate and do different things. It's not just my opinion, it's also the result of a study that Harvard University did. They did a long study, 75-year study on a number of men, and they followed them for 75 years to find out what is the key to a long and happy life. Is it diet? Is it education? Is it financial success? Is it spiritual? Is it health? Is it progeny? And they summarized this 75-year study with one line, which is shocking. Good relationships keep us happier and healthier, period. We all know that as we age, it's harder to remain connected. People move, family gets busy, and it's easy to slide into isolation. If we didn't know that now, the last few months of COVID certainly brought that home. Living in a community enables you to make connections that go in places you may not expect. So if you're interested in a CCRC, there are only two things you need to do. One is a health assessment, and the second is a financial assessment. So financial assessment, let's take that first. It's a simple form, 2 pages. You put your age, your assets, and any CCRC will run the numbers, do your projected time frame, and tell you what you qualify for, what apartment style, since they're all different prices. They provide an overview of spending over your lifetime, which is really great for people who are worriers like myself. The healthcare assessment varies by community. Some CCRCs say if you have a pre-existing condition, we won't let you in. If you've had a fall in the last 6 months, we won't consider you. Birch Hill does not have that. And what we do is you just fill out a simple form that says what your prescriptions are, etc. You meet with our nurse practitioner and you do a slight cognitive test. And that is where I encourage people, if you're interested, if you think that you would be interested, take the test, get your, do your financial assessment so you understand, does this make sense for me or not? Because The only reason we would not allow someone into the community if they were financially qualified is if they had some significant cognitive loss. Because if you have cognitive loss, you can't be independent. So I encourage people to do this sooner rather than later. Just quick touching on COVID, we're very excited to announce that we are COVID free at Birch Hill. This unprecedented pandemic has hit older adults. We have learned a tremendous amount, and we, as the RiverWoods Group, have done a very aggressive job in keeping everyone as safe as we can. We have access to PPEs, sanitizing wipes, testing. If you lived here, this is something you don't have to worry about because we have covered it for you. We are protecting you. We understand the rules. We watch the guidelines every single day. So people have told me they are so happy to be here because they feel less isolated. They feel safer. They know that we're taking care of them. So I think CCRCs matter more now because of the confluence of sociological factors and healthcare factors. We have better healthcare, which means we have increased medical costs, and we're living longer. So it means we have higher lifetime medical and long-term care costs that typically come at the end of our life. Also, we have a sandwich generation. So our kids are getting married later. We have dual career couples. Our families are more far-flung. So if you think back to your grandparents, generally people were staying in the same area. Generally, women stayed at home. They could check in with their parents more often. Now, your children are generally could be living somewhere else in a different part of the country. They could have dual careers. They're raising their families. The kids are far away and busier than prior generations, and you are more independent. You are not interested in sitting around and waiting for your kids to call. You want to make your own choices, and you want more out of life because you are going to be living longer. So that's why I think this 100-year-old concept of a CCRC is really hitting its prime right now. I think this is a perfect opportunity for CCRCs. So we have just a couple minutes. I'm going to talk to you about what I think your options are very quickly, and then we're going to go straight into questions. So please start writing your questions down. One, you can stay home and nothing will happen to you. So you can, people like this. I'm going to stay home and I'm going to wake up dead. Nothing is going to happen to me. I'm not going to have any emergencies. I'm not going to need any long-term care. I'm just going to, go one night in my sleep. That would be great. It's too hard. It's too bad we can't plan for that. Those are the immortal teenagers. The second is the bunker mentality, very popular in New England. I'm going to stay home and I'm going to bring in services. I'm going to bring in housekeepers, bring in lawn guys, bring in snow guys, bring in any care that I need. I'm going to stop going down cellar. I'm going to stop going upstairs. I am going to stay independent in my home with everyone coming in. If that is your plan, and I know many people, it's your plan, think about this inverted triangle. It is going to be harder with this dwindling demographic to get people who are going to provide care at home. So if that's your plan, do your research. Find out how much it's going to cost. Third option, cohabitation. Great if it's your first boyfriend or girlfriend. Not so much fun when you're 80 and your kids are 60 and you're moving in with them. If your plan is to move in with your kids, tell them. Have that conversation. Believe me, your kids are wondering about this. They would welcome you having the conversation about, here's what I'm thinking. Start opening that up. Be the brave person to say, I have been doing some research and I want to share my thoughts with you. The fourth is assisted living or nursing home. This is directly related to 1, 2, or 3. If you stay home or you live with your kids and there becomes a time where you need nursing care, then you will go directly to assisted living and nursing home. You may not have a choice. It may happen in a crisis. If it's a crisis, it may not be your decision. The fifth is a CCRC, which is a great option for people who like to plan, for people who want to know what their future is going to look like and know what it's going to cost. Before we go into questions, I want to just mention that if you felt this was helpful, we are doing a really great webinar or a web event on August 12th, which is the art of right sizing, which we have Kate Grondin and Ellen Sullivan of Wayforth. We've worked with them for a long time. They're great people and they know a lot about downsizing. And I don't know anyone right now that couldn't use downsizing, and we're all stuck at home anyway. So it's a great time to start thinking about how you could downsize your life and your stuff. So think about sharing and signing up for that. We've got the link right there. And it is, I think, 10:35. And so I'm going to go to the Q&A. And
It looks like there is one question, Kathleen.
Yep.
If the entry fee is refundable, how and when is that paid?
Okay. So that's a great question. And it varies on CCRCs, but generally the entrance fee is refundable once, if you're a couple, both people have left the community, either they moved out or they passed away, and we resell the apartment. So generally that's when it happens. It's very unusual for you to access your refundability during your lifetime. We are the only community in New England that has that 70% use it during your lifetime option.
Okay, and I have one more. I guess the gist is, how do I know which services and amenities are included in my monthly fee? Does it vary by community?
Yes. So what I provided is a real overview of all CCRCs, but the most important thing is look at the contract, because every single CCRC is different. We like to say if you've seen one CCRC contract, you've seen one. There's no universal. So you need to find out what is in every contract. Generally, it's what I had described, but every single community is different.
Okay, now we have a question about long-term care insurance.
Mm-hmm.
Is it true that you need to have 2 or more ADLs before it kicks in? And
Okay.
Sure, I'm not an expert on long-term care insurance, so I don't know what an ADL is, but maybe.
ADLs is an ADL is called assistance with daily living. So there are certain things that are the skills of daily living: eating, bathing, dressing, medication reminder, toileting. And the question is, when does long-term care kick in? And yes, unfortunately, the answer is it depends on your long-term care contract. So there are as many different long-term care contracts as there are CCRC contracts. What we typically do is we say, bring in your long-term care contract with us. We'll take a look at it. We will tell you how it kicks in, when it kicks in, and we will help you figure out how that impacts you from a financial standpoint, because everyone is different. And the long-term care industry has had tremendous upheaval in the last 6 years, and a number of organizations have gone out of business, and some the premiums have increased. So I think it's settled down now, and the companies that are here to stay, which is great. But again, I can't say a universal answer on that.
Okay, the next question is wondering if we are partnered with a particular hospital in the area.
It's a great question. And we do not choose the hospital. You choose the hospital. So in the Manchester area, there's CMC and the Elliott. And some people prefer one over the other, depending on what your procedure is. You have free range to choose whichever hospital you like. You choose your own doctors. You can choose doctors out of the area. We provide that long-term care that is not covered by Medicare, but in terms of hospitals, you can go wherever you want.
Okay, and next question, they're coming in hot now.
Great.
Do we have partners with hospice companies?
Also, you can choose a hospice company that you prefer. We work with every hospice company in the area, and that is a very personal decision. Anyone that you want, we will work with.
Okay, next question is, could you discuss the pros and cons of profit versus nonprofit CCRCs?
Okay, that's a great question. So there are not very many profit CCRCs. So I will tell you what I think the pros are for a nonprofit. Our goal is to do the right thing for the resident. Our goal is to make sure that your life is better when you're here than if you were living at home. And we assume you had a pretty darn good life at home. We are not committed to quarterly numbers. We are not committed to making a certain margin. So in an example like COVID, we took all the resources we had to get the PPE that we needed at no matter what cost it was required, and turned ourselves inside out to make sure people had what they needed. I don't know that you would have that same attitude in a for-profit, because a for-profit is looking at the numbers. They are trying to maximize their profit. Our focus is on the long term. We are not going out of business. We are here forever. Nonprofits have been around for 100 years, and only one bankruptcy in the history of 100 years, even during the financial downturn. So, and that CCRC was acquired by another CCRC. So we are incredibly stable. We have a very long-term mission. We are extremely conservative when we plan, when we grow, and we don't skimp on care. So if you were in nursing care and you had to choose between someone who is trying to make sure their margin, they hit their margin at the end of the day, or someone who tried to make sure you had exactly what you needed and the care that you needed and didn't skimp on that, what would you choose?
Okay, so there's 3 more questions.
Okay.
First, is there a medical director associated with Birch Hill?
Yes, we have a great medical director who is extremely experienced. He's done this work for 20 years and has a great relationship with our healthcare team.
Okay.
Dr. Riscala is his name.
Next question, acknowledging that everyone's situation is personal, is there an average age when residents move to Birch Hill or a CCRC in general?
That's great. I love this question because it comes up every time, because numbers matter, right? So here's how I answer that. There is generally an average age. People generally move between 75 and 85 is the time that they move. And everyone moves at a different time for a different reason. And I like to answer that to say, it depends on your energy level. So we all know moving is tremendously tiring from an emotional and physical standpoint. And so I think you need to move when you have the energy to downsize and move your home and still have energy left over to move into your new place and be ready to meet new friends. And it is not good to wait until the very last minute and go when you feel you almost have to, because you are not getting the benefit out of the CCRC. Typically in a newer community, we have younger people because they are more open to risk. So in Durham, the average is in the 70s. In Exeter, it's probably in the early 80s. Birch Hill, probably early 80s, the same thing. But we're getting younger and younger people in because more people are understanding the concept and saying, this is the way I want to live. I want to live an easier life. Hope that's a good answer.
Yeah. Is there a yearly increase for services and housing?
Yes, that's a great question as well. And I don't have the 5-year trend, but if you send me off the top of my head, but if you send me your email, if you put that in, we'll send you the 5-year trend. The monthly service fee does increase, and the entrance fee increases every year. And the reason for this is over 50% of our budget is salary. So we have a tremendous amount of staff. We are a very high touch business, and salary and benefits eat up a huge chunk of our budget. We do zero-based budgeting every year, but costs and benefits costs go up every year. So we try to keep it under 3% per year, but I can again give you that average, and you should ask that for every CCRC that you're looking into. What's the 5-year average?
Okay, speaking of staff, is there 24-hour nursing staff?
Yes.
Okay. Can you talk about the differences between the RiverWoods Group communities in New England?
Oh, sure. That's a good question. So the RiverWoods Exeter is the first community, and it's a little bit of an anomaly. We have 3 separate campuses here in Exeter because we like bite-sized growth, because we're conservative, but we know our mission is to bring this way of life to as many people as possible. So there's 3 campuses on 200 acres. It's very rural. We are in Exeter, which is a little college town. In Manchester, again, we have this really unique community at Birch Hill, where we have a community of 130 homes. In Exeter, it's about 400 across the 3 communities. In Birch Hill, it's 150, and it's in this beautiful wooded area that nobody believes is 10 minutes from Manchester. We are across from a 600-acre nature conservancy, and it's a very dynamic place. You've got all of the culture of Manchester, just a short car ride away, and we get a lot of people who love that area and have ties to that area. In Durham, we have about the same size as Birch Hill. It's 150 independent homes. It's a new community just on the outskirts of Durham, which is a college town. So we've got, Exeter, which is kind of a PEA academy town, college town, and then Birch Hill, which is also rural and very beautiful, right downtown Manchester. So they all have totally different personalities.
Okay, and then how long is the wait list? Does one pay a deposit to go onto the wait list?
Okay, so again, it depends. And right now at Birch Hill, you can move in directly because we have taken a number of homes offline. We have completely gutted them. We've redesigned them. We've got new granite countertops and new appliances and lighting. And so you do not have to wait at Birch Hill. In Exeter, there is a wait list that goes from 3 years to 7 years, depending on the size of home, because depending on the size of home, that's the wait list you would join. In Durham, it's probably 2 to 3 years wait, depending on the size of home. And in the RiverWoods Group communities, you have to put 10% of the entrance fee down. So that is a significant amount of money. In other CCRCs, they will accept your, they will accept a deposit of $1,000 or $500. It's a little less significant, but here we really want to make sure that everyone has done the research, they've looked around, they've looked at other CCRCs, and that they want to come here. So the people we know have chosen us.
Okay, great. Another question is, are you able to visit the community at this time?
Thankfully, yes. We have opened up for tours. We are, as I said, extremely conservative, so you can't just drive up and walk in. You have to call, make an appointment. We will screen you, including temperature screen. You will be masked. Your marketing counselor will be masked as well. We will show you the common areas in a couple of apartments. And we're trying to bring the community as close to you as possible in a lot of different ways. So we have some lunch and learns that we have set up through Zoom where you can connect with other residents. But yes, you can absolutely make tour appointments right now.
Excellent. And then one last question here. Could you talk a little bit about the food? This is an important part for my father.
Oh, yeah. It's an important part for us too. We have a fantastic chef at Birch Hill who came from a very, very top-notch restaurant, actually based in Exeter. All of our chefs have been restaurant trained, and we have a variety of options every day. So it is beautiful plated served food. You choose from, I think, like 6 or 7 or 8 different choices every single day. Fish, steak, chicken, there's vegetarian options, there's gluten-free options. We're expert at moderating different choices based on your diet. So your meal is cooked for you to your specifications. So we know that this is a big part of everyone's life. It's a social part. So we put a lot of time and attention into the dining experience. Typically, we have served dining in white tablecloths with serving staff. Right now, we are delivering meals to people's homes. Because of COVID, we're not doing the dining experience like we have done for a million years. We'll get back to that.
Right. Yep. Things will get back to normal. There's one last question that popped in. Just time, I think we're done. Are there storage areas for each resident?
Yes, every resident has storage areas. And we also have bike racks and places if you want to store a kayak. So yes, we definitely have storage areas. As I say, we have inadequate storage, meaning you have to downsize your house still. You can't avoid downsizing your house and put it all in storage, but we do have storage.
Okay. Last call for any questions. I don't see any more.
These questions have been fantastic.
I agree. These are really good. A very engaged group today. Again, this is recorded, so we will receive a copy of this in a few days, along with a link to the PDF version of the Insider's Guide. And I don't see any other questions, so I guess we'll go ahead and wrap up for the day.
Yes, and I think I just want to find my last screen, which is on the presentation. It will give you contact information for Birch Hill. Feel free to give us a call to schedule a tour. We are happily scheduling tours again. So feel free to come see us.
Yes, you could schedule a tour right on our website, birchhillrc.org, or call 836-2302 and chat with Carmen. She'll set that up for you.
Okay.
And Michael says thank you. Thank you for attending today, Michael.
Thank you all very, very much. I hope we see you at Birch Hill soon. Have a wonderful day.